The term gut health may seem a little slangy, but it's actually very important to our overall health. Here to explain why are Doctors Tracie Leonhardt from Peaks of Health Metabolic Medical Center, along with Dr. Robert Rountree today. Welcome back, Dr. Tracie, and welcome, Dr.
Hi.
Robert. How are you?
Great.
Well, thank you. It's good to be back.
So, gut health. As you were saying, 70% of our immune system wrapped up in there. So really, when you're talking gut health, what does that mean?
Well, it can be a lot of things. A lot of people are told they have like irritable bowel syndrome. Specifically, you know, us, we look at that gut, we actually look to see exactly what's going on with it, and we actually treat it to fix it, whether it be, you know, dysbiosis, which is really common, which is abnormal bacteria and overgrowth that can lead to something called leaky gut.
Okay, so a lot of terms in there, Dr. Tracie, that I'm going to have to hit the pause button on. You
Exactly.
know that. So kind of like let's back up a little bit and talk about exactly what we're talking about and what you've been able to find in some of your patients.
Okay, first of all, let me just throw out a really wow fact to you.
Okay.
Which is that we know now there's something like 30 trillion bacteria and viruses and fungi that live in our gut. There's
Really?
about 10 trillion human cells. So there's more foreign microbes that live in our gut than there are human cells. There's more of them than there are of us.
And this is a good thing?
And this is a good thing. We have to be friendly with them. We've been friendly with them our whole lives. But what happens if we get unfriendly with them? What happens if we take antibiotics?
Oh.
You know, what happens every time you take a course of antibiotics for a strep throat or an ear infection or bronchitis, it throws those healthy bacteria out of balance.
But like, let's use the antibiotics that you were just talking about as an example. Sometimes those are necessary.
Absolutely
So
necessary.
Absolutely.
How do we keep things balanced and do, you know, we don't want to do harm to our body when we think we're doing the good things.
Well, that's why, you know, if our patients go on an antibiotic for a reason, we always put them on a probiotic with it so we can replenish that healthy bacteria as the antibiotic is killing it.
And probiotic, I hear that word, I think, thrown around a lot. You hear it for different foods. You hear it even on commercials these days. How can you get a good source, since you're telling me that is so key? How do you get a good source of probiotics? How do you make sure that those levels stay up?
You can eat probiotic food. So probiotic means for life.
Okay.
Right? It just means it's something that supports healthy life. So eating fermented foods like sauerkraut or fresh fermented pickles, kimchi, Korean foods, all those things are good for you.
What about yogurts? I feel like you always hear probiotics when it comes to yogurt talk. Is that enough? Is that good?
Well, most of the yogurts only have one strain of probiotic in them. Most of the people hear something called Lactobacillus acidophilus.
I'm glad you said that, not me.
We like big words, right? But you need a variety. So while, you know, yogurt does have some probiotics in it, it usually doesn't have a good enough variety.
So we're talking about this kind of in general, but I think we need to target it down and how your practices are able to help patients when you've got someone to come in. What are some of the symptoms that you see in people and why maybe they need to contact someone like yourselves?
Well, it could be that the symptoms are only gut symptoms. You know, we've mentioned irritable bowel syndrome, Crohn's disease, ulcerative colitis. So serious bowel disorders, those are the obvious things, but sometimes people can have unhealthy guts that lead to an unhealthy body. They can have joint aches after eating certain foods. Why is that? Right? It's because what we're eating is actually affecting the health of our entire body. If 70% of the immune system is lining the gut, that immune system is constantly interacting with the bacteria in our gut, with the food in our gut. So if that gets out of balance, then that creates systemic health problems. So obviously, that's a good place to start when you want to get a person well.
And how are you able to do kind of testing it, or what is the process like when someone's like, yeah, maybe I need to try something different for my health, and they give you a call?
Well, in a lot of cases, we can actually do a stool test that's called a comprehensive digestive stool analysis and actually look at the bacteria in their guts. Look how much they have, look how little they have, look at what's out of whack, and actually start correcting it that way. Other times it's just a matter of giving them a good overall probiotic, but you can use probiotics for specific things. You can use specific strains to fix specific things. So that's where we start choosing those items for that patient, you know, depending on their symptoms and what we find.
And it all begins with a consultation. And if you give Dr. Leonhardt a call, you get a free 15-minute consult to start things off. There's the information on your screen. Thank you to the both of you for coming in today.
Oh, thank you.